My name is Celina. I like to run and work out and lift. I'm trying to get into swimming again, and it's a lot of work at a nonprofit. I came in because I've had chronic issues with my left leg, but it turns out it was also my right leg kind of taking over. And it's been years of it since running in high school, like little things would here and there. I never felt like there was always something. So I would always have something like bugging or nagging, and then I even tried stopping running and just exercising. I was okay, but I always really loved to run, and I would always get shin splints right away. So I looked it up. I looked, and HealthFit popped up, and great reviews, and I was like, you know what, let me give it a shot, because going through my insurance, you can only treat one thing. And I was almost positive it was more than one, because I had some upper body issues too. It was more of a holistic approach here, which I really enjoy, opposed to like, well, you can only treat the knee because that's what you're approved for, instead of like, well, my shoulder hurts too, or like my foot hurts too, but they can only address one problem. So that's mainly why I've been sticking with physical therapy for what's like 15 years off and on. So, but now it actually makes more sense. like it coming here. It's so much. Like it's never just like one thing. It's all interconnected. That's what I always had a feeling, but she really confirmed that for me and was just like, yeah, it could be your hip, but it's really it starts with your feet. Or it's like even the issues I've been having with my shoulder have been coming through with like, my breathing or my rib positioning. So I've actually learned so much, and it's like my right leg had been taking over so much. It's actually been struggling more because I've had to relearn, opposed to like my left, it's starting from scratch. But she's also taught me to try to kind of like be patient with it. It's like, and just to like really focus on the form, and then just like trusting like the whole process. So, well, it depends on the day. I'll come in, she'll ask me like what I want to work on, or what's if is something bugging me more than the other. So if like it's like how my foot's kind of been tight or feeling numbness, we'll focus on getting the tightness out, and she'll really come in on my calves, which I totally love. And then we'll focus on some exercises and making sure I'm not gripping, or I'm making sure I'm like activating the right areas instead of like overcompensating. But yeah, there's some days where it's like purely like, okay, let's just do manual. It's a combination of both. There's some that's just purely exercise based. She has her plan, and she kind of like guides me through it. Or if like there's some days where I completely throw the plan out the window and be like, something's going on with my neck, and she's like, all right, let's get to it. So it really depends, but we mainly going over the exercise. Also, like as she's working on me, she goes over the exercises and asks me questions like where do you think this is coming from? And then she'll explain it, and it will make perfect sense as to what's happening. But yeah, it really depends on the day, which is what I really like. It's not just like, this is your plan for the day, we're sticking to it. It's a lot of adjustment to my needs. They're okay. No, they're always great. Always reminding me when my appointment is, and on my case when I'm never on time. I've worked with like a few of the PTs too, and they're all been really great and helpful and knowledgeable. But yeah, no complaints. Everyone's really great and like happy and smiling. You know, like everything is like, the biggest one is like everything's connected, and everyone's been really great and supportive, and it's like being patient is really important, and giving myself like grace to like mess up and like look awkward when doing stuff. And but like in PT isn't just, you know, like, oh, you focus on one area. It's all interconnected, even like with the breathing. Yeah, I think it's just, for me, it's just like how one part being off throws off the rest. So I think that's what has been really crucial, I think, for me to understand that like I have to do one, like, you know, go back to the basics, and then it will work out. Well, we both have cats. It's just really cool. But and that I think she's a dancer, right? And it was like I like how I also like I think that's why I really trusted her because she's so like with dancing. It's all being really connected with your body. So I like thought that was always really cool, and like she's very calm. Yes, I have. I'm trying to get more people to come in just because I think you guys are all so great. Like, it's kind of like this sum of all your parts. You guys are all so great and understanding and patient. And I really love that you get one-on-one with the PT, that you're not just kind of handed off to anyone and they don't just like check in to go, how to go. It's like you're with the PT the whole time, and that's why I keep like, you need to come here. It's totally worth it.